is a hip hinge using a stick or a dowel. You can use something comparable to this, like a Swiffer stick or a broom. We're going to place it against the back, and the idea with the stick is we want to make sure that it stays on the back, so try not to, as we hinge, we want to avoid this. So if it stays on the back here, sometimes once you get to about this range, the stick will start to come off the back because we're not maintaining a neutral spine. So try to keep a neutral spine, meaning relatively straight as you hinge. Let me switch sides so you can see better. So starting upright, gently pressing the back into the stick, maintaining that so the stick stays flush against the spine the whole way through. We're going to use a wall so that it helps cue us to hinge and stick the hips back. So that's another key with this, is making sure that your weight is a little bit more back in the feet, back in the heels. We're going to stand about a foot away from the wall. Stick is on the back, pressing the low back into the stick, and then hinging back. With this, my knees are stationary. I have a soft bend in my knees, and I'm just pivoting around the hips. Hips shift back a little bit. I'm trying to find the wall, gently tap the wall, but note that I'm not sitting back this way, so the wall's really not supporting my weight at all. I'm just gently tapping the wall with my bottom and then coming up. As I come up, think about really squeezing the glutes to initiate the upward motion. You really should not feel this in the back at all. The glutes should get a little fatigued with this, even just with body weight. I'll do that one more time. So starting upright, stick is flush against the spine, and then I'm shifting my weight back. Weight is a little bit more in the heels. Soft bend in the knees, knees are stationary, hinging forward, finding the wall, gently tapping the wall, trying to get to at least parallel if I can, and then squeezing the bottom to initiate the upward motion. Slow and controlled, making sure you're coming all the way vertical, all the way upright. So you're pressing the hips forward, try not to stop here, come all the way straight up.